Hello, my name is Dr. Alan Wong. I have been a dentist in private practice in Denver, Colorado the past 26 years. 8 years ago, I started Sapphire Technology to develop a new and improved line of composite instruments. Instruments that decrease composite adhesion, thereby making placement easier, that allow for a better and improved restoration. Given extensive material research, my development team determined sapphire was an ideal material for the instrument tips. This is the instrument we developed, the patented SGS composite instrument. Note the clear sapphire tips. What improvements and benefits does sapphire allow for? Since the sapphire tips are virtually non-porous, this leads to decreased composite adhesion and pullback during material placement, making placement easier. It also leads to a denser and better compaction of the composite into the prep. The reduced adhesion negates the need to use bonding agents as commonly used to increase the slickness of metal and plastic-tipped instruments. I have found this to be a cost-saving measure given the expense of the bonding solutions. The surface finish of the sapphire won't degrade like metal instruments. The instrument tips will perform like new, day in and day out, and provide consistent performance. The clear sapphire tip provides minimal distortion and filtration of the curing light, allowing the instrument to be left in place during the curing process. Applying slight condensation to the composite during the cure leads to a more condensed composite once the cure has been completed. The following picture is a cross-section of an extracted tooth with a restoration completed by a coated metal instrument. After completing the restoration and prior to completing the cross-section cut, the top of the tooth was coated with India ink. The ink was allowed to penetrate the tooth by simple gravity. Note the arrows. Any ink seen in the cross-section picture along the margin of the restoration is evidence of a compromised margin, evidence of micro-leakage. The next picture also represents a cross-section of an extracted tooth. In this instance, however, the restoration was completed with the SGS instrument. Note the absence of any ink along the margins of the restoration. How clean the margins are. This comparative test was performed on several extracted teeth with similar result. What do more condensed restorations with better margin and seal lead to? Fewer voids, less recurrent decay, and less post-op sensitivity. Improved restoration also leads to fewer potential remakes, the cost of which we as practitioners absorb. Fewer remakes per year more than justifies the cost of the device. I further believe a reduction in remakes leads to greater patient satisfaction. I would encourage you to try the SGS instrument. It being my hope you too will realize all the benefits of the instrument, just like I have since developing them and using them daily in my own practice the past 6 years.